Gramagat Ceann Comhairle, Taoiseach, public confidence in your ability to manage the COVID crisis has collapsed in recent months. Today you promised clarity, but instead what we have had is further confusion. Dublin is left in limbo. Our citizens over 70 are left without necessary guidance, and your travel advice is confused and unsure again. But most strikingly, Taoiseach, is the absence of any comprehensive plan to step up testing and tracing capacity. You and I know that people are waiting, in some cases 6 or 7 days, for results from their tests. And it is that inefficiency which allows the virus to take hold and to transmit across our communities. You've made an appeal again, Taoiseach, today to individual citizens to shoulder their responsibilities, and that's fair enough. But the fact is that you are failing in yours. You see, you can publish whatever plan you want, but they're not worth the paper that they are written on, so long as our testing and our tracing capacities are so woefully inadequate. So you have to get this right, because a first-class testing and tracing system is the springboard for everything that we want to see. It's the sure mechanism to allow people to return to work and stay at work safely, to allow children and students to return to education and to stay there safely. It's also essential to ensure that our health system doesn't become overwhelmed at a time when trolley figures are creeping back up and waiting lists for outpatient appointments are at record levels. And the truth is, Taoiseach, that you and your predecessor, Leo Varadkar, have failed to put in place the testing and tracing system that we need. And that is the carrying out of at least 100,000 tests a week with a guaranteed result within 24 hours. We hear stories of people constantly waiting longer than that. And let it be said, Taoiseach, that both you and Leo Varadkar have had numerous opportunities to put in place this testing and tracing system. In April, your now Cabinet colleague, Leo Varadkar, and Simon Harris said that they would be doing 100,000 tests a day by mid-May. We're now in September, and that target has not been reached. Back then, in May, the then Taoiseach dismissed my call for these 100,000 tests a week, and I have to say at that time, in a very arrogant and a very condescending manner. Then on the occasion of the publication of the reopening roadmap, that was another chance to get testing and tracing right, but it didn't happen. And then you formed your government at the end of June, again a prime opportunity to get things right and to put an emphasis on testing and tracing, but you failed again. Infection rates dropped in the course of the summer, and you were again presented with an opportunity to get this right, but you didn't, and now the virus has caught up with us. And the people in Kildare, in Laois and in Offaly have already paid a very heavy price for your failure, and now the people of Dublin face further restrictions and more disruption to our lives. And the growing rates of infection and this disruption are directly related to your government's failure to get things right. So, Taoiseach, I want to put this to you. Amongst all the bluster and the very, very long press conference that you hosted earlier today, there is one inescapable truth, and that is either you get testing and tracing right and you do it quickly, or we will be consigned to a yo-yo effect of further restrictions and even lockdowns. And I have no doubt that citizens will carry the burden of their responsibilities, but the government has to measure up to theirs.
Well, in the first instance, could I say that the government has published a very comprehensive plan today in terms of living with COVID-19 for the next 6 months. A plan that basically has 3 key principles: to protect lives, the health of our people, and also to limit the damage that COVID-19 can do to people's health long term, to protect employment and economic resilience as best we can, to keep jobs in our economy and enterprises viable. And then in terms of quality of life and the restoration of public services, to do what we did with the schools. That was a very confidence-boosting measure, Deputy, which you failed to acknowledge, to bring 1 million people back into our schools, children and teachers. I think was a very significant thing to do in the middle of a global pandemic. Sorry, with respect, I didn't... come on, stop interrupting now. Sorry, John Corley, this is unprecedented that people are now intervening. It's the Sinn Féin way, maybe, from time to time parliamentary. But I think that is the situation. And I regret the fact that the Deputy has decided to take a very partisan and political approach to this issue today. Because I have said that in terms of public services, I've referenced education. It's also about what will be unprecedented challenges facing our health service over the coming winter. And over an additional €600 million has been allocated. And will be allocated to innovative measures to deal with capacity issues right through the 6 months. And that's additional money on top of what is there to the end of this year. And in terms of testing and tracing, I note the contrast in terms of the Deputy's language today around testing and tracing and the performance of the HSE and her approach when I facilitated a briefing with the HSE about 2 weeks ago. There was none of this talk about woeful performance. Over 1 million tests has taken place in this country since the pandemic. Ireland is right up there in terms of other European countries in terms of its testing capacity. And it's not good enough to attack people as being woeful and trying to belittle the very strong measures that have been taken on testing. And of course we all wanted to increase and ramp up. And it can do 15,000 a day now. And has been at that level now under a lot of pressure in terms of community need and requirements. You've ignored the serial testing programme in nursing homes that was undertaken. Very comprehensive twice now, which yielded very low positivity rates, thanks be to God, but has kept pressure on the virus in those locations. And likewise elsewhere as well. So the plan today is comprehensive and it deals with a whole range of areas, but fundamentally it's about keeping people safe, keeping jobs, protect as many jobs as we possibly can, restore public services, and also in terms of quality of life, help and assist sports and the arts in particular to try and develop and provide performances and so on, notwithstanding the limitations of COVID-19 itself.
It seems to me, Taoiseach, that you're making it up as you go along. It seems to me if you're serious about protecting public health, employment and people's quality of life, well then you would actually measure up to a commitment made months ago that 100,000 tests a week would be carried out and that people would be in receipt of their results within 24 hours. I have the COVID app on my phone. So it might interest you to know, Taoiseach, that over the last 7 days, less than 75,000 tests were carried out. This is months on from a commitment to hit the target of 100,000 tests. And can I say to you, to keep people safe, to keep the economy on track, to ensure that we have some quality of life, including social opportunities, it's my view that we need more than 100,000 tests per week. But you haven't even yet reached that target. And the truth is, when trouble flared in the Midlands because of meat processing plants and when numbers started to climb, by your own admission, by your own minister's admission, you didn't have the testing and tracing capacity to catch up. There was a huge time lag. It's very telling in today's plan that you've issued. Of 59 pages, one of them addresses the issue of testing and tracing, the most central part of the plan, and you have failed. And I have to say to you that people in Dublin, I suppose particularly today, but right across the state now, are frustrated with your inability to see the most basic thing, which is get testing and tracing right, and then you allow us the opportunity for all else to follow.
Shamelessly playing politics with this, Deputy, and you know it. I agree 100% in relation to testing and tracing and the centrality of it, and it's in the plan. You know it's in the plan. in terms of ramping up testing capacity and contact tracing capacity and extra numbers being employed. That is the reality. And you talk about the Midlands. The government action on the Midlands was quick, it was tough, but it yielded results in terms of stabilising the numbers in the Midlands and getting the numbers down in Laois, Offaly and Kildare at the time. And that will continue, and we will continue to improve and strengthen our testing and tracing responses. And it is a central part of the plan that we've outlined today. And critically, we also have to be straight with people as well in terms of the need for all of us, in terms of personal responsibility, in terms of adhering to the public health guidance. And we have accepted NEFIT's advice in relation to Dublin today, and the government have acted on that, and NEFIT will meet again next week in that respect, because our fundamental objective will always be the protection of lives, protection of harm to people as a result of COVID-19, and then maintaining, the essential public services that we need, that our children need, that our young people need in going to college and education, and in terms of our health services, and putting all the resources we can to withstand what will be a lot of significant pressures coming the winter time on our health service as a result of COVID-19. That is both of those are very, very important, as well as other aspects of the economy and jobs as well.
Thank you very much, Deputy.